So we'll do a few things today. We'll do an overview of student health. We'll talk a little bit about the immunization requirement because while we don't necessarily own it, it is something that we manage quite closely and has an impact for a lot of areas. And then we'll talk a little bit about just kind of college student well-being and some of the things that we're working on in the more student affairs and learning outcomes oriented space around student wellness. So kind of work through those bits and pieces today. So if you're not familiar, we are the on-campus healthcare provider for our students almost exclusively. 2020-21 has been an interesting year where we've done some additional care for faculty staff that we don't normally take on around some COVID vaccines and other pieces, but normally just focused on those students and really experts in their care. We have a full team of healthcare professionals, and we're open Monday through Friday. So we really are kind of a business week operation, trying to get students used to working with that medical practice hours. We do encourage appointments largely because our students are so busy that we want to get them in, we want to get them seen, we want to get them back to what they're doing with the least amount of time required for them. So we do encourage those appointments so that we can be respectful of their time and get them in more quickly. Though we do have some services where walk-in is available. And I think one of the things that's really important that we don't necessarily always get shared across to students, a lot of times what they're looking for is just guidance. And so our students can always consult with a registered nurse for free, whether that's our nursing team during the day or our evening weekend nurse triage line. There is always a resource available for them to talk to if this is the health situation I'm in, what do you think I should do to get that navigation, which is just such a foundational part of their transition from for our young adults transitioning from home into becoming their own healthcare advocates, and for our students who are maybe a little bit more seasoned, who just maybe new to the area or who are trying to navigate in the middle of classes or who aren't sure if they should go to the ER and kind of in that gray space. It's a great service. We do have a full team. So board certified physicians, nurse practitioners, we have psychiatrists on staff, a range of clinical providers, nurses, and x-ray techs and phlebotomists, and all of the support team that we need to be able to provide robust care to our patients. For those who might not be familiar, we are located in the beautiful Cal Pooley Center, which is right next to the ENS field and a hop, skip, and a jump away from Viejas. So we are located, relatively convenient to a good chunk of residence halls, which is helpful for our students, certainly to some commuter parking, which is helpful. So in a good location to try to help support students while they're here. And in our building, I think it's really helpful that it's not just student health. If you're not familiar, this space really is an all-inclusive set of wellness resources for our students. So you've got us, you've got counseling and psychological services, wellbeing and health promotion, and Student Ability Success Center. So in a lot of ways, they're able to just kind of pop into Cal Pooley, and if they're not sure, or if they walk in the wrong door, we're going to help them get where they need to go. So one of the most common questions we get is, what type of services do you offer? There are two kind of splits there. So our students who are enrolled at SDSU pay a health and wellness fee, as part of their tuition and fees. And as was included in that, for student health, there are some pieces of that fee that help support other departments and the services they offer within Cal Pooley. But basic care is what we are able to provide to students as part of that tuition and fee. And that includes basic medical visits, some lab tests such as CBC or urinalysis, x-rays, and then some medications in treatment to whatever they have going on. We also offer specialty care. These are services that the student needs to pay an additional fee for that aren't covered as part of their tuition and fee, but that are often very essential to what they need. So that may be an immunization, it could be a medication, or a specialty visit with the orthopedist who comes in about once a week, once every 2 weeks, depending on the time of year. those services are offered at cost, essentially. So many times they are offered at far less than what students are able to get out in the private community. So we have a number of things that we will see students for. Are the typical kind of thing that we see them for is that illnesses and injuries. Kind of the things that you would see your family medicine provider for, or maybe a lower level express care, urgent care type of issues. We also do a lot of health screenings, including sexually transmitted infections, and education around reproductive health and treatment and care there for, birth control or contraceptive methods and things of that nature. We do a lot of physicals for our students, travel, participation, Department of Transportation, if they need one, for some states require that, club sports, any number of physicals to help support the many things they want to do. The immunizations, including flu shot clinics. We have our annual Boo to the Flu campaign that we partner with Wellbeing and Health Promotion and the School of Nursing to bring flu shots to our students on campus when everyone is on campus. This year was a little different. We have our pharmacy where we provide a wide range of over-the-counter medications, again, at cost, so often less than the student would be able to get at the local pharmacy or grocery store. So very convenient for them right on campus if they need something. And then referral to specialists. So a number of specialists require that you get a referral from your family medicine or primary care provider in order to be able to see them. So we help can make those referrals to those specialists, or if a patient needs a specialty imaging exam for follow-up on some kind of situation, so like a CAT scan or MRI, we help facilitate that.
Libby, sorry to interrupt. Can I ask a really quick question?
Mhm.
Is the pharmacy open to the public? Like, can faculty and staff go there for their over-the-counter stuff?
Yeah, absolutely. And as well as, we have parents and families who are in on tours and, need a Band-Aid or, need some Advil. It's open to anyone, and we take cash, credit, check. And eventually we're working to get some things in play where they can swipe their Red ID to pay with their dollars that they have on account with the university. So
Awesome.
it's
Thanks.
super convenient, and many of our staff pop downstairs to buy what we need because it's so much easier than going to the store. We also offer for our students, and they have used this year in connection to COVID, our online student health portal. So students have the ability, every student has to use it in terms of submitting immunizations, which are required, and we'll talk about a little bit in a minute. But they can get lab results, they can schedule appointments, submit secure messages. This is how they're scheduling for their vaccine appointments and their testing right now. This is how they upload their COVID test results. So a lot of pieces where they interact. We always remind people, particularly for our younger students, that it is for the student secure use. We want them to have that secure private space to be able to message, and we remind them not to be sharing that password or that login information, with parents or others, so that they have that space with their healthcare provider to be able to communicate privately. But it is very convenient space to kind of fill out your forms and get information and be able to engage with us from wherever you are. And again, kind of in that vein, when, I think this is helpful context. If you're talking with students, or if you have questions from a parent about how we work with students, we work directly with them. They are our patient. That is our patient, provider relationship. And we do encourage everybody, right? Students, faculty, staff, we encourage people to have support people involved in their health. But it is the students' right and their role to request who it is that they want us to engage in those conversations, and to be able to make the decision about when they want those people in the conversation, so that we're really helping create that space for the student to be able to talk confidentially and honestly about what's going on with their health. And the student information is confidential. It's a common question that comes up. Student health services is part of the university, right? So if I talk with student health, for instance, if I'm an ROTC student and I talk with student health about some anxiety that I may be experiencing, would that be reported to my ROTC program where it could maybe have some potential implications if I have concerns about that? Or if I have an STI, a sexually transmitted infection, is my faculty member going to know that? And the answer, is no. We really do create that confidential care space for our students, and that includes students, who are in our global studies program, who are in Imperial Valley. If they are connecting to the institution, they're able to access student health just the same. So there's a lot of options for students in every regard. And then again, right, one of the common questions is what happens in an emergency? We want the student to directly engage with their parents, with their support persons if they are alert and oriented. And if they're not, then the university is engaging in their normal process of connecting with those emergency contacts. And of course, this year has been different than any other. So for the last 14 months in these times of COVID, as we call them, we've just had some different work that we've been doing for students, which includes that free COVID-19 testing. We've done 31,000 PCR tests for our students, and I think another 2,000 to 2,500 antigen tests for our students this year. We're also offering COVID-19 vaccines as supplies have allowed. We know that that's been an in-demand service. We also have our COVID case assessment and response team who helps lead our isolation and quarantine work, the contact tracing, and some of the other measures that we need to put in place when we have cases on campus, and that on-campus clearance process for those students who are in the required COVID testing program. And again, we encourage students to call ahead. There's a lot of screening that happens still when students present for care so that we can make sure that we're screening them for signs of COVID and protecting them as well as our staff for any ongoing COVID infections as we continue to try to get this pandemic under control. We do have an immunization requirement here at SDSU, and student health has a significant role in managing that. So there are a number of immunizations that are required. They're listed there, and our students are able to submit as soon as now, in fact, for our incoming students, so usually in mid-February. So we work with them to try to get that information on file. And again, it's just a matter of trying to help protect our community. These are immunizations that are required across the CSU with a couple of little tweaks and additions here at SDSU around meningococcal B, really based on some of the experiences we've had with outbreaks in that regard. I know that the question that will come up as we look at these requirements, and we won't go through them in detail, is what about the COVID vaccine? As Dr. De La Torre shared in the Fall 21 Flex update, students for the fall are going to be required to either test often and regularly or have a vaccine on file. Beyond that, we continue to watch to see what those requirements look like and how all of those things continue to evolve. And as we know, things change very rapidly. So we will definitely share out with the community as we know more on that one. And again, they submit that through Healthy Connect. So that portal really is just kind of central to the students' role with us. And then I think one of the things that we talk a lot about is just kind of how to be a healthy student at SDSU. And it's something that we at Student Health spend a lot of time individually helping students navigate through, as well as, kind of trying to work in the collective with our partners in wellbeing and health promotion and counseling and psychological services. And then, trying to partner across student affairs and something that we're trying to build more and more of those relationships and networks, right? We know that, for instance, working with our Pride Center, there's so many pieces of health that we need to be extra attentive to for our LGBTQ plus students or for our trans students, just additional elements there. And so how do we build those partnerships? How do we build those relationships in those programs? How do we work together to help provide care to those students and create comfort and trust in student health as their provider? So a lot of work happening in that regard and building those foundations And I think it's been since we consolidated into the Division of Student Affairs and Campus Diversity, those linkages and those abilities to provide population health have been getting stronger. And it's one of the things as we come out of COVID that's a big priority for us. So in that regard, we do talk a lot about health insurance. Right now, the CSU does not require students to have health insurance, so there's no waiver like you may have heard or seen at other institutions, though we do recommend it. As you can imagine, we spend a lot of time helping students navigate to various care experiences for using their insurance. You know, if they have the unfortunate, accident of one of the motorized scooters on the cobblestone, and they go tail overhead, and we have a broken arm, for instance, and we need to refer them to an orthopedist. We're working with that student around making sure they've got health insurance, or connecting them through Wellbeing and Health Promotion to Cover California, and meeting with the enrollment counselors on campus, so we can really help reduce the burden of those healthcare costs while they're here. So it's a common question and something we continue to try to build the education, build the infrastructure for them, help them navigate, and make sure we're just being very attentive so that students don't have undue financial burden. One of the other things that we talk about, and this is a slide that I snapped from one of the conversations we have with incoming students every year, because I think it's so important, is talking with our students and our parents at Explore, with our ambassadors, so when they're doing the tour, about just the importance of having a well-being plan for when students come to school, right? They're so used to the structure of whatever their day-to-day life situation looks like, whether that's they've been working a solid 40-hour-a-week job, and they haven't had school to take on in the evenings and weekends, or they've been living at home with their parents and now they're coming out on their own. What is their plan as they take on this new adventure and this new chapter in their life to stay well? Do they have chronic or recurring conditions that need to be tended to? Are there medications they need to take? It make it harder to make time to go to the doctor, or how to schedule those appointments so that they continue to do those things they need to do. We see things like patients who have diabetes that has been very well managed for a long time, either at home or when they're working as adults, just doing kind of the full-time job thing, that they've been managing really well. And when you add that extra layer of taking all these additional classes, or you're eating, you're picking up food to go suddenly on the way from work as you rush to campus for your evening class, or you're staying up late, or you're not sleeping as much, you're not taking as good care, you forget to take a medication because you've got some additional stress going on, we see their well-being plans sometimes get disrupted. And sometimes that disruption can be healthy, right? You're learning, you're growing, your faculty members are helping you stretch and grow, you're hopefully making social connections, you're doing incredible things to grow and further yourself as a person, but it comes with some additional impacts for health and well-being. So we talk a lot about having a plan. How are you going to sustain your wellness? How are you going to manage if things start to not go well, right? So what are you doing to stay well? And then if things start to not go well with your health and wellness, who are you going to reach out to? What are your resources that are available? Where can you go to have those healthy outlets? So if physical activity is incredibly important to you, how are you going to transition that to the institution? Is it a club sport? Is it, having membership at the ARC and making time for walking on the treadmill and lifting weights, or taking a yoga class, or any number of those things? So we're really approaching health and well-being from that holistic space. We also talk quite a lot about bringing a care kit. We're always a little bit surprised when we get students who have moved here, relocated to San Diego County from wherever it is that they are, and they got nothing with them, right? So we want to make sure they have those thermometers and those over-the-counter medications, so that if they're not feeling well in the morning, they've got those meds to kind of treat a minor headache or allergies that they experience in San Diego that they maybe have never had before. Bringing that water bottle so they can fill it up on campus. This year, coaching them around things like hand sanitizer and facial coverings to bring in those care kits. And then just continuing to emphasize like having those photos of your insurance card, because they always have their phone, but they don't necessarily carry some of the other items and wallets and purses or bags or things that they may, just because they're inconvenient things that they have to track around with them. So trying to help provide that education and build the foundation for students as they transition into the institution to help create kind of that wellness foundation for them to really build on. And again, this is the core of the work that we're doing, and really was in very close partnership with Wellbeing and Health Promotion and counseling and psychological services, right? Like there's virus prevention, and this year that has been so focused on COVID, but that is COVID and strep throat and, STIs and doing the things that you need to do to prevent getting sick. But movement and food and nutrition and really the whole holistic approach to health and well-being, those preventative appointments, those follow-up appointments, to help students really become the owner of their health and wellness, and doing the things to further that as an important part of their academic success. Because what we know is that students who are physically moving have higher academic performance. We know that students who report that they are doing things to address their health have better academic outcomes. We know that when we ask them on a national survey that we administer every couple of years, what some of the top inhibitors to academic success are for them, they cite things like anxiety and depression, cold, flu, and other illness. They cite things like their nutrition or feeling overwhelmed and stress. And so really getting them to think about the whole picture and how it all comes together, particularly around their academics and ultimately furthering their goal of graduating, and how this contributes to things like Graduation 2025 initiatives, is really one of our key priorities right now. And then I think the one thing that we sometimes forget is that while student health is a little different than most of the departments on campus, we just fill a slightly different role for our students. We are, at the end of the day, still at an educational institution, and there are still educational outcomes that we are working on with our students. So there's really 10 key or core learning outcomes that we're trying to help them master, so that by the time they leave SDSU, they are prepared to, take on being their own best advocate for their health and wellness. And so those things are, can be as simple as scheduling an appointment, right? For our 18-year-old student who is coming to school for the first time, they may never have scheduled an appointment for a medical appointment on their own. It may have always been a parent or an older sibling or a guardian who has done that for them. That can be a really intimidating thing to pick up the phone, which is something we know our students don't necessarily like to do, but many physician practices are still very old school and want you to call to schedule, or want you to email in to schedule. And how do you articulate why you're looking to be seen or what the severity of that is? Completing health history forms, having a relationship with a provider, that white coat, if you will, with a doctor can be very intimidating, even for those of us who have been around the healthcare game for a little while. How do you interact with a provider? How do you ask questions? How do you tell them when you disagree with the care plan that they have recommended, or where you don't think it, meets every need, or where maybe they're not hearing some of your questions? How do you develop that relationship and be able to navigate those conversations? Student health is a great starter for that, to build that safety and that confidence and that experience for our students. Managing the many financial pieces that go with prescriptions and co-pays and EOBs and all of the things that can be a little bit difficult. And then really, making assessments. How are you feeling? Are you feeling overwhelmed? What can you do about it? What are potential solutions to those well-being concerns? You woke up and you don't feel well today. assessing just like we all would at home. Is this something where I need to call my doctor today? Or is this something where, maybe it's a minor cold and I just need to start with maybe some over-the-counter medications? Helping them build those self-assessment skills and then identifying solutions to those is really important. And then I think the last one is one that we all has people can struggle with, and it's so important, is asking for help, right? Recognizing when you need help and reaching out and finding safety and confidence in that and destigmatizing it, right? That it is not weakness. It's not a sign of anything other than strength to say, this is an area where I need help and can you help me? And student health certainly wanting to step in and create that safe space for them to be able to ask those questions, ask for help, and then get that help, whether it's with us or us helping to navigate them to, whomever it may be that's the best resource for them. So I know it's a lot of information, but wanted to provide time for kind of questions, answers, anything that I can kind of help answer around student health, the work that we do, the partnerships that we have on campus, et cetera.